The threat posed by some variants of COVID 19.
And that is a highly transmissible strain. It is also a more lethal strain.
The connection between masks and stress for grocery store workers.
And a lot of them felt verbally threatened, sometimes even physically threatened.
And an update on key legislation passed at the Capitol.
I imagine we will be here for at least another month, if not longer.
Hello and welcome to Arizona 360. I'm Lorraine Rivera. Thanks so much for joining us. Across the country and in Arizona, distribution of the Johnson & Johnson COVID vaccine is on pause. This is the CDC and FDA look into reports that a handful of recipients developed blood clots. That revelation kicked off our discussion with Dr. Joshua LeBaire, Executive Director of ASU's Biodesign Institute. How did this happen given that clinical trials had already occurred?
Right. So there have been 6 reported cases of blood clots that have happened within a couple of weeks of the vaccine. Probably worth mentioning that it sounds a bit similar to what has been observed with the AstraZeneca vaccine, both of which happen to be adenovirus delivery systems. Keep in mind that these are really rare events. There have been 6 cases reported in almost 7 million people receiving vaccines. That rate of event is so low you would not pick it up in a clinical trial. It's the kind of thing that you could only pick up if you're monitoring very carefully all the outcomes in all the doses that you deliver. And so they've obviously deployed the vaccine, almost 7 million times, and so they picked up this kind of rare event.
There are somewhere north of 220,000 people in the state of Arizona who have received the Johnson & Johnson vaccine. What should they be looking out for if they're hearing this news and they're concerned?
Right. What the observation here is in primarily younger women, sort of the 18 to 44-year-old range, something in that ballpark. Uh, and um, and some they get these blood clots. So it's something to look out for in that population. As I mentioned, it's a very rare event. It's probably also important to keep in mind that in that same age group where there were 6 reported events nationwide, there were 700 people in Arizona who died from COVID. So the COVID is much more common a killer than the blood clots are.
You and your colleagues at the Biodesign Institute up at ASU have recently discovered a new variant of the coronavirus. How concerned are you?
So yeah, Ephraim Lim and his team have identified a variant that has a mutation in the spike protein that is similar to what's been observed in the South African variant that may allow it to evade some of the vaccine immunity. There have been some data to suggest that even in real world terms, people who get variants like this may still get infected by COVID-19. Now, a couple things to remember though. This particular variant has not been observed frequently. There have only been about 17 or 18 cases to my knowledge so far in Arizona, much less common, far less common than the UK variant, which is becoming more dominant in our state and which does respond well to the vaccines. Also, really important to remember that even if people can get infected with the virus with the vaccine, they still don't have bad outcomes. For the most part, uh, uh, people who've been vaccinated, even with variants that have this mutation, still do not get severe disease or die from it.
What do you make of Arizona's current case rate and the fear that another surge is coming?
So it does look like the numbers are starting to creep up in Arizona. We are starting to see a slow but nonetheless kind of day over day rise in cases. So we do have to keep a very close eye on that. Certainly in other parts of the country, there has been the beginnings of a surge, Michigan in particular, but some parts of the eastern seaboard are also starting to see a rise in case numbers. Probably my biggest concern in Arizona is the growing dominance of the UK variant, the so-called B117 variant, which we do see rising rapidly in Arizona and I think will soon become the dominant strain in our state. And that is a highly transmissible strain. It is also a more lethal strain than the older variant that we had in Arizona. And so we really do have to watch that. The best advice here is to get out and get vaccinated. And when you're out in public, to wear masks and follow all of the recommendations we've repeated over time about physical distancing and all that stuff.
As people continue to follow all those measures, they want to move on and they would like to know why, in some cases, the vaccine isn't preventing against the virus. So they're at a loss. Where is that balance in achieving the public health, but also slowly starting to return to normal practices? What do you recommend?
So right. So what the vaccine is really good at, and I mean really good at, is preventing severe outcomes. So if you personally have been vaccinated, the risk to you to get a severe outcome is very low. The vaccine does reduce by far the risk of getting the virus, but it doesn't eliminate it entirely. And that's why we recommend mask wearing, so that you don't become an unwitting carrier of the virus to somebody else. Now, of course, once we get to that herd immunity, once we get most everybody vaccinated, then we don't have to worry about that so much. And then we will be able to get back to, no mask wearing in public events and going back to restaurants and even going to concerts.
Dr. Joshua LeBaire from ASU Biodesign Institute, thank you for your analysis.
Yeah, thank you. Take care.
As masking up goes from being a rule to a recommendation, results can vary. Arizona 360 heard firsthand from residents across Pima County about what drives whether or not they decide to wear a mask.
I think it's very important to wear a mask.
There was a time where it was needed when everything was in a panic last spring when nobody knew what was going on. But when you look at the numbers, I just don't think it's necessary.
Since I don't have the shots yet, I think it's good to wear it.
It's the best way that I can offer other people protection from coronavirus.
I think that people should do what they want.
I wear one out of respect for businesses when I go into business, but as you can see, when I'm walking outside on the streets, I'm not going to wear a mask.
There are some businesses that don't require it, and I'll go without.
Our customers, our clients, and yes, our team and our staff will wear masks.
It not only protects us, but it also protects our residents here in our town.
I will continue to wear one even though I've been fully vaccinated.
I would like to think that everyone around me also would still wear a mask.
We know firsthand what it can cost.
I trust my own inner authority.
I trust the city of Tucson more and the health department more than Governor Ducey.
I think that whatever the governor does preempts any local authority.
I don't know. I follow the local mandates because that's the community I'm in and the people that I know.
I think I trust my local government.
It's very confusing to know what the right thing is, and I think that people hold on to different opinions fiercely.
I think at the end of the day, we just need to do what we think matters to us and what we feel safe doing.
The issue of mask wearing, the ability to choose and how those choices affect others have captured the attention of sociologists at the University of Arizona. We heard from two about their research, beginning with Dr. Jim Shockey. Shockey analyzed national data that tracked how people have behaved during the pandemic and how their ideologies weigh in.
I'm tempted to say I think it's a lot, but I think it's complex. I think there's probably about 10% of the population, from what I'm finding based upon survey data, that is strongly inclined to not wear masks, to not keep physical distance, to maybe not maintain appropriate hand hygiene because of their political beliefs, because their belief that we live in a free country and they shouldn't have to wear a mask in public. 10% is pretty small, but 10% on the other hand is pretty large when you're thinking about the consequences and the degree of spread that could result from 10% of the population doing absolutely nothing.
Your work will be featured at a discussion with the American Sociological Association this summer. How do you hope that will inform future discussions?
Well, I think that an increasing number of social scientists are paying attention to the behaviors. I look at the literature and I don't see a great deal of information where sociologists, psychologists, certainly political scientists maybe have more in the past couple of years because of the politics of this country. But social science hasn't paid a whole lot of attention recently to mask wearing, to physical distancing, and so forth, things that are incredibly important to us and are increasingly part of our culture. No one did this. No one would have thought 2 years ago that we could have essentially stopped the country and everybody routinely would be wearing a mask. How can we maintain the momentum of appropriately trying to prevent disease spread in this country and frankly around the world? It's going to be very easy after we all get vaccinated, after things start to settle down, to go back to our old ways. So we have to find a way as a culture, as a society, to try to avoid backsliding and keeping some of the momentum that we have.
You are optimistic that this will improve our behavior in society, though you are concerned that this wasn't perhaps enough to tilt us in that right direction.
I think that if we continue to wear masks, we maintain physical distance, we go out cautiously in the public settings, and we all maintain good hand hygiene, I think that we can go a long way to reducing this sort of thing in the future. If it comes back every year, which we don't know, it could be a routine annual outbreak, just like the flu has been. We don't know. But if we have learned anything through this, hopefully it will allow us to ramp up more quickly next time, that we won't start out as slow as we did last March and April and May in through the summer, and that we'll be able to learn from our mistakes. And I do think the bulk of us will do that.
Okay. Dr. Jim Shockey from the U of A School of Sociology, thank you.
Thank you.
Businesses that require masks often include grocery stores, but customers don't always follow the rules, putting employees at risk of exposure unless they act as enforcers. Dr. Brian Mayer, whose research involves surveying workers about their concerns, says either position can take its toll on their mental well-being.
So all the way back in July 2020, we launched a survey we call the Arizona Frontline Worker Project. And that asked grocery store workers primarily to talk to us about how they were doing in their workplace, right? There was a lot of uncertainty in the summer. And then we just finished up with another round of that survey in February. And what that tells us is that most, let's call it about 60% of those workers feel safe at work, but that means about 40% still do not. And they're very anxious. There's signs of depression, as well as high levels of stress that are still continuing in that population.
Businesses are private companies, so it's up to the employer to help enforce some of these requirements like wearing a mask or physical distancing. Do they feel supported, the grocery store workers?
Not at all. That was the number one thing we heard loud and clear, was that lots of workers reported encountering difficult, agitated, angry customers, and a lot of them felt verbally threatened, sometimes even physically threatened. But when they were telling us those stories, it was always accompanied by, "I wish management would do something to support me." And so even though we know today that grocery stores still have signs saying that masks are required, social distancing is requiring, it's not being enforced. And workers are really left to their own devices to figure out how to navigate those difficult situations. And it's stressful and it's damaging to their mental health.
Did your report find anything about why employers are hesitant? I imagine it probably has something to do with the bottom line, but also not creating an uncomfortable environment inside a grocery store.
Right. I think the question comes down to responsibility. And so you could see both sides of the coins. And so we didn't get to talk to any employers. We're just listening to the voices of the workers. But if you think about the situation, what does a store manager, what does a company policy want? Do they want their worker to have to confront someone who's going to get physically violent with them about wearing a mask? And the answer is probably no, right? Which is worse. And that's a really difficult situation to be in for those companies, and lacking state policy on how best to manage that. They've really been left to themselves. And we see this very uneven application of, do I have to wear a mask in the store? What if I don't want to? What if a worker asks me to? What do I do as a customer? And it's similarly puzzling for those workers in terms of how do they sort of protect themselves?
The workers that you surveyed, how did they feel about having to wear a mask or gloves for their own personal protection? And then, of course, vaccines came into the picture here.
Sure. So going all the way back into July, one of the surprising things that we found is a worker's sense of safety isn't really based on those physical things, having to wear masks themselves, having partitions put up at checkouts, having signage. Those things were important, but what was most important was having access to regular safety training, which I think speaks to this question of management and enforcement, as well as being able to tell customers to sort of to follow the right policy.
You mentioned that your survey took place in July, which was well into the pandemic. Anything in your research show that their feelings had evolved over time?
A couple of things did change. One was sort of the fear of COVID seems to have gone away, at least partially, replaced again by sort of this fear of interacting with difficult customers. We also saw more folks not willing to get vaccinated. So we asked a hypothetical question. If the vaccine was made freely and conveniently available to you, how likely would you be to get it? And that number went down by about 10%. Those that felt that they would be strongly likely to get it remained the same, but those were undecided tended to move towards being opposed to vaccination. And that was surprising.
Did they offer any reasons for coming to that decision?
We did ask, what would be a reason that you would get vaccinated and what would be a reason why you wouldn't get vaccinated? The number one reason why they wouldn't get vaccinated was fear about possible side effects.
And finally, Dr. Mayer, you mentioned side effects like anxiety. I mean, that can be detrimental to a workplace, and these are critical jobs that these individuals are performing. Looking into the future, what does that tell you about safety in the workplace, and is it sustainable for people who are managing these issues to be at the grocery store to service everyone else?
I don't think these current levels of mental health distress are sustainable at all. What needs to be done is we need better guidance from the Occupational Safety and Health Administration with cooperation from the CDC so employers know what is required of them should they enforce mask policy. So hopefully we learn from this pandemic and provide these employers from large to small with clear guidance on how to do that. And I think that would be beneficial to the workers there, that they can know what management is expected to do and trust in that. That's beneficial for customers, that they know what to expect when they go into a store. And that'll make the lives easier of these companies in terms of what policies they need to have in place.
Okay, thank you for your insight, Dr. Brian Mayer, the Director of Undergraduate Studies at the School of Sociology at the University of Arizona.
Thank you.
At different times, the pandemic put the brakes on a lot of services, but not Tucson's public transportation system. Tran kept operations going with some adjustments. Tony Paniagua reports on how Tran continued to serve passengers and overcome financial setbacks.
The Tran public transit system was founded in 1969 and has grown steadily over the decades. Today, it encompasses the bus system, Sun Van for the disabled, and the Sunlink streetcar service. The buses cover more than 40 routes in the metro area, which prior to the pandemic carried about 50,000 passengers each day, like Joella Gonzalez.
I'm satisfied with it. I really am.
Gonzalez has a driver's license but no car, so this is her main way of getting around, pandemic or not.
It means everything to me because either I walk or take the bus. I don't wait for nobody. I ride every day. Every day.
From where to where?
From Green Valley into Tucson. I got to take the shuttle and the bus and then back. So, yeah, it's a long day.
In fiscal year 2018, from July 1st of 2017 to June 30th of 2018, Tran provided more than 15,200,000 rides. In fiscal year 2019, that number had dropped by about 1 million to over 14 million rides. But in fiscal year 2020, which ended last June and was impacted by the coronavirus, rides had gone down again to about 12,300,000.
Most systems in the country lost 40, 50, 60% of their ridership. Seattle lost 70% of their ridership. We had an initial drop of about 40%, but now we've recovered to the point that we're within about 15% of where we were pre-pandemic. And there's only about 8% of the transit systems nationally that are closer to their returning to their full service.
And Tucson has been doing that while not charging any fares. That decision was first made by the mayor and council in March of 2020.
And at that time then, as part of a safety protocol, we moved to rear door boarding so that we could provide, better safety for our employees. And they continue to be fare-free today. In February, they actually voted to extend the fare-free system through the end of this fiscal year.
That's at the end of this June. It costs the system about $700,000 a month in uncollected fares, but federal funds have kept the wheels turning so far.
I think it's good. It's convenient right now because you don't have to pay.
Suntran requires wearing masks, which is authorized by the Federal Transportation Security Administration. It doesn't answer to county or state policies about masks.
It don't bother me. And we got to take precautions.
I don't mind wearing a mask when I'm on the bus or just out roaming around. I was smoking. I had it down for a minute. I've seen people get cross with bus drivers. And for what?
Suntran General Manager Steve Spade says there has been a learning curve for everyone in public transportation. Moving forward, this will require new maneuvers and adaptations.
So we've been through a lot of things in transit, whether it's snowstorms, blizzards, floods, hurricanes. Those kind of things only last a few days or a week. The fact that this has been so prolonged is, I think, what's made it really hard. And I know our folks have done this for over a year now, and it's a real testament to them, how hard they work.
Governor Ducey signed a bill this week that legalizes sports betting in the state, just one of dozens signed into law this legislative session. We checked in with Arizona Capital Times reporter Julia Shamway to discuss significant events at the legislature. Let's begin with the headline of the week, expanding gambling in the state of Arizona to include sports betting. Proponents say this pumps at least $100 million into the state of Arizona. What was some of the kickback that delayed the vote?
So there was a lot of trouble just getting this bill up for a vote in the Senate, in part because one very powerful senator, David Gowan from Sierra Vista, who's the chair of the Senate Appropriations Committee, tried for a while to hold up this bill, which is a priority for the governor, in exchange for getting some things that are a priority for him, including increasing per diem payments, the daily allowances that lawmakers get to cover their costs of commuting to Phoenix, or allowing for historic horse racing, which is betting on horse races that have already happened. The governor didn't want either of those. There was a standoff for a few weeks, but finally this week, this bill came to the Senate floor, and within a few days, Governor Ducey had signed it.
I mean, what you're describing is political theater. This is, if you vote for this, I'll give you this. Is that what this came down to?
Yes, absolutely.
All right. I want to talk about another topic that came up this week that is really causing some controversy, a bill about sex education. And it looks like at this point, parents will have to give the green light for a school to teach their child things about gender identity. What's the latest?
So right now, you still have the opportunity as a parent to opt out of sex education. And a number of Republican lawmakers want to change that to requiring parents to opt in. This bill, which is waiting for a signature or veto from the governor as late, it needs to happen by Tuesday. This bill would also potentially prohibit any acknowledgement of sexuality, homosexuality, or gender identity in other classes. You might not be able to learn about, say, Harvey Milk being the first elected gay official. You might not learn about homosexual themes in reading materials. And it's unclear just how far this would reach. There were a number of parents of gay and trans youth standing outside as the governor prepared to sign his sports betting bill this week, trying to urge him to veto this other bill that they say will have a really bad impact on their children and potentially others.
As legislators start to wind down, let's talk about something that is also kind of fizzled out, it seems. Legislation over voting. We saw this in other states across the country. Did it gain any traction in Arizona this session?
It gained quite a bit of traction, but right now, as we're talking, it's unclear what the future of a number of these bills might be. There are quite a few that are still waiting for debate or votes in their second chamber, although that could happen at any point between now and when lawmakers call it a session and adjourn sine die. So, one thing that we did see in the past few weeks was the business community really coming out and condemning these bills, the law that just passed in Georgia and bills on the move in other states. It does seem that Republicans in the legislature are holding back a little. They don't want to pass anything too big while there's so much attention on it, but these bills could always come back. The governor did sign one bill that would ban the use of private funds for elections. This is targeting something that a few counties and the Secretary of State accepted private funds to do voter outreach when the legislature did not come through with the funding they had requested.
And time is truly of the essence because they usually start to wind down session to sine die. Are they targeting late April, May, or should I say we're moving into June on this one?
Don't make any vacation plans is probably the best answer for that. They are supposed to wrap up their session within 100 days, and we are coming right up on that 100-day mark. But I imagine we will be here for at least another month, if not longer. Part of it's that there's just so much money to spend or to give away in tax cuts. And when there's more money to divvy up, there's a lot more people who want a piece of it, and the session tends to drag on.
And we'd be remiss if we didn't mention COVID-19. Looking back, you've been there every single day, whether it be virtually or outside the Capitol. How did that impact discussions this session?
It's definitely a very different Capitol this year. So there's very limited public presence. In the Senate, most days it is just me there as a reporter, and I'm stuck up in the gallery. I can't even go onto the floor and talk with people because they replace their press tables with Zoom screens for senators. There aren't members of the public there. So even if they're passing bills that would normally bring out, say, the Red for Ed teachers and have people pack this gallery, you don't see that presence. And so it's a very different, more subdued session. If you look in some ways, when you look on video, it looks like it's a normal year now because most Republicans in the legislature have done away with their face masks. And if you can get a screen that's just them, it's almost a semblance of a normal year, just with fewer people around.
Julia Shamway, thank you for your insight joining us from the Arizona Capitol Times.
Thank you.
That's all for now. Thanks for joining us. To get in touch, visit us on social media or send an email to Arizona360 at azpm.org and let us know what you think. We'll see you next week.